heart disease has been increasing, really started to increase in the United States starting in about the 1950s. But realized that we didn't know what caused heart disease in the 1950s. And I would even argue that today, 70 years later, we're still not completely sure about what causes heart disease. In 1980, this paper came out. What they did was they looked at 246 possible risk factors for coronary heart disease. And we see some pretty interesting things that come up on this list. This is just one page of one of the tables that goes through the 246 risks. And we see things that we would expect, like high blood pressure, obesity, we see comes out with a risk. And then there are things that we would not expect, such as having an earlobe crease or slow beard growth. Some people had thought at some point that these could be correlated with heart disease. When we start to get down to blood measurements, what we found at that time was having an increased serum total cholesterol or LDL cholesterol carried with it about a 1.8 increased risk. So 1.8 times the baseline risk associated with having an increased total cholesterol. However, having a decreased HDL, what's oftentimes called good cholesterol level, carried with it a 3.4x risk of heart disease. And then we go down to the risk associated with triglycerides, and we see 2.6. Then we get to your fasting blood sugar or having a decreased glucose tolerance, and we see that that has a 1.9x risk associated with it. And finally, we get to insulin resistance, 4.5x risk associated with that in these studies. So, early on, it was apparent that there was significant risk associated with having abnormal glucose metabolism, insulin resistance. And then, there was a little bit of risk associated with LDL and total cholesterol levels. We see that HDL and triglyceride levels were more predictive of risk. These risks become important when we start looking at interventions that might change these things in different ways.